Cow calves care. Caring for cow calves involves several important aspects to ensure their health and well-being. Here are some key considerations. Colostrum feeding. Immediately after birth, calves should receive colostrum, the first milk produced by the cow. Colostrum is rich in antibodies that help boost the calf's immune system. It's crucial to provide colostrum within the first few hours of birth to ensure the calf's health. Nutrition. Calves should be fed a balanced diet to support their growth and development. Typically, this includes a milk replacer or whole milk for the first few weeks, transitioning to solid feeds such as calf starter grain, hay, and fresh water as they grow older. Consult with a veterinarian or livestock nutritionist to determine the appropriate feeding plan for your specific circumstances. Housing. Calves should be housed in clean, well-ventilated, and adequately sized facilities. Individual calf pens or hutches are commonly used to prevent disease transmission and provide a controlled environment. The housing should protect the calves from extreme weather conditions and provide adequate bedding for comfort. Hygiene and sanitation. Maintaining cleanliness is vital to prevent the spread of diseases. Regularly clean and disinfect calf pens, feeding equipment, and water containers. Provide fresh bedding to keep the environment dry and comfortable. Health monitoring. Regularly check calves for any signs of illness or distress. Monitor their weight, appetite, and behavior. Promptly address any health concerns by consulting a veterinarian. Vaccinations and deworming protocols should be followed as recommended by professionals. Socialization. Calves benefit from social interaction with other calves. When appropriate, introduce them to each other to facilitate socialization and reduce stress. However, ensure that new introductions are done gradually to minimize the risk of disease transmission. Weaning. The weaning process involves gradually transitioning the calves from milk to solid feed. This process usually occurs around 6 to 8 weeks of age, but can vary depending on individual calves. Consult with a veterinarian for guidance on the weaning process and appropriate timing. Regular veterinary care. Establish a relationship with a veterinarian experienced in livestock care. Schedule regular checkups, vaccinations, and health assessments for your calves. A veterinarian can provide guidance tailored to your specific herd and address any health issues that may arise. Remember that proper care, nutrition, and management practices are essential for the well-being and growth of your cow calves. It is always advisable to consult with local experts and professionals to ensure you are providing the best care for your specific circumstances. Cow calves' health. Ensuring the health of cow calves is crucial for their overall well-being and productive growth. Here are some important factors to consider for maintaining their health. Vaccinations. Calves should receive appropriate vaccinations to protect them from common diseases. Consult with a veterinarian to develop a vaccination schedule tailored to your specific region and herd health needs. Common vaccinations for calves may include protection against diseases like respiratory infections, clostridial diseases, and others. Parasite control. Calves are susceptible to internal and external parasites, such as worms, lice, and flies. Implement a deworming program recommended by a veterinarian to control internal parasites. External parasite control can involve using approved sprays, back rubbers, or fly control methods to minimize infestations and discomfort. Nutrition. Providing a balanced and appropriate diet is vital for calf health. Ensure they receive adequate amounts of colostrum within the first few hours of birth to boost their immunity. Following that, gradually introduce them to a nutritionally balanced milk replacer or whole milk, along with solid feeds like calf starter grain and hay. Consult with a livestock nutritionist to formulate a diet plan suitable for your calf's specific requirements. Hygiene and sanitation. maintaining a clean and hygienic environment is essential to prevent the spread of diseases. Regularly clean and disinfect calf pens, feeding equipment, and water containers. Adequate ventilation and proper drainage are important to minimize the risk of respiratory and other infections. Monitoring and observation: regularly monitor calves for any signs of illness or distress. Observe their behavior, appetite, and overall appearance. Detecting early signs of illness allows for prompt veterinary intervention, which can be critical in preventing further complications. Record keeping: keep accurate records of vaccinations, deworming, health events, and any treatments given to the calves. These records help track the health history of each individual calf and assist in identifying trends or patterns in disease occurrence within the herd. Biosecurity: implement biosecurity measures to minimize the risk of introducing diseases into your herd. Control access to your farm, limit contact with external animals, and maintain separate facilities for new or sick animals to reduce disease transmission. Regular veterinary care: establish a relationship with a veterinarian experienced in cattle health. Regularly consult with them for herd health management, routine checkups, and advice on specific health concerns. They can perform regular health assessments, provide guidance on disease prevention and treatment, and address any health issues that may arise. Remember that maintaining the health of cow-calves requires a holistic approach that includes proper nutrition, vaccination, hygiene, and vigilant monitoring. Regular communication and collaboration with a veterinarian will ensure that your calves receive the best possible care and support their healthy growth.